In continuation with the previous video of depression, this video is about anxiety and how to identify patients who have anxiety issues. Most of the times, patients come with symptoms like fear, a deep sense of insecurity, fear of the known and the unknown. They could be also having some phobias like claustrophobia or fear of heights or fear of insects, fear of certain things impending which are going to happen, fear of disease that they may die out of it, and so on and so forth. So, what happens when this fear reaches a particular pinnacle, I would say, or when it reaches a particular extreme level? It results in a panic attack. And in this panic attack, there is already palpitations happening, there is already a sense of impending danger, or the person is already apprehending that something is going to happen and they are not prepared for it, or they feel they are not prepared for it, and they have a lot of fear attached to it, and they don't know what might happen. And with this increase of palpitations, increase in the pulse rate, probably the heart rate, and increase in the respiration as well, they could just break into a sweat and just freeze. So there is this thing of, the fright and flight response, as you call it, in most of the subjects. Now, why is this anxiety there? This anxiety could be stemming out from a lot of issues which have been bothering a person for a long time, or maybe it has happened to them in the past, or because of their painful experiences or unpleasant experiences in the past, or because in the childhood or as they have grown, they have been made to feel like this because of various events that would have happened in their life or various characters that have been there in their life. It could be anyone. It could be a close one. It could be somebody, not related to them. It could be anyone. Sometimes, even normally, when a person comes inside the clinic, and sometimes when we are about to check their BP too, the otherwise normal person and otherwise who would be fine and the BP would be normal, their BP, when it is checked in the clinic, shoots up. Now, this is called white collar hypertension. So, the moment they come into the clinic, there is this sense of thinking, I hope or the moment the BP is going to be checked, they feel that, okay, I hope my BP, is okay. And in that process, it actually tends to go a little high. Like a childhood panic to come into a doctor's room for the fear of getting injections or, those kind of things, or painful experiences or unpleasant experiences. Some of the patients also do stammer while talking. Or some subjects, I would not say just patients, I would say anybody for that matter who has a bit of anxiety, who has apprehension or not sure how to place themselves, uh, or want to place themselves perfectly, to have that perfect pitch, you call it, or placing, would sometimes get into a dabble of words. They would fumble, they would stammer, and that would furthermore their anxiety. Some people just drop things. It's like they have butterfingers. Some people stumble and fall. So, anxiety can really lead to a lot of issues for people. I mean, they would go on the stage possibly and they would just blank out. There would be students who would go to a viva and then just blank out, although they have studied well and but still they're not able to answer properly. So stage fear, exam fear, all these things come under this entire perspective of anxiety. So how do we go about addressing it, and what do you do about it? There are a lot of homeopathy remedies which can help you overcome your anxiety, which can also help you overcome your stage fear, exam fear, and help to build your personalities too, to a certain extent, because the rest is in your hand. Of course, there is psychological help and counseling also that is available. So, if you do have any of these issues you're suffering or going through, please do get back to us, because it is not a nice scenario where you tend to stammer, fumble, stumble, sweat out, or have palpitations, throbbing pulsations all over the body. I'm sure none of us are comfortable with this kind of scenarios. And you should know how to cope up with it and how to overcome it. A little bit of stress, a little bit of anxiety is required to keep us going, but not too much of it. When it becomes too much, it becomes a nuisance. You need to get rid of this. So please do reach out to us and get to us. We'll try to do our best for you. Thank you so much for listening and hearing us out with patience. Appreciate it. Do like and subscribe and comment on our videos. Thank you so much.